Hi, my name is Dr. Alex Hakim, and I'm a board-certified physician in internal medicine, sleep medicine, pulmonary medicine, and critical care. My training includes medical school at the University of Southern California, residency at UCLA, and fellowships by both UCLA and Cedars-Sinai. I'm also trained in the use of cognitive behavioral therapy for insomnia and mindfulness techniques by various programs, including from the American Academy of Sleep Medicine. I'm the founder and CEO of SleepDoc LA, which is a unique and important development in the management of sleep difficulties because it combines comprehensive medical management of common physical ailments that are disruptive of sleep with psychosocial assessments and guidance to provide the most meaningful long-term benefit for you. Being trained in respiratory pathology allows me to diagnose and treat things like sleep apnea using gold standard methods. Combining that with a gold standard psychotherapeutic approach to insomnia management allows for a more holistic care that is validated and recognized in the medical literature as being by far the most effective. Through experience, we have come to understand that sleeping in a sleep lab for testing in a new, unfamiliar and uncomfortable place with bulky equipment strapped on is not ideal for diagnosing your sleep problems. I learned that people frequently don't achieve the duration and depth of sleep necessary at sleep centers to obtain representative data of their sleep. SleepDoc LA acquires and implements the latest and most comfortable devices to allow for testing in your own home, testing which is both accurate and convenient. I know many of you had sleep problems for a very long duration, and you have resisted going to a sleep doctor by telling yourself that you don't have the time or that the process will be tedious, difficult, and the therapy is awkward. Because I know that untreated sleep disorders are strongly linked to decreased quality of life and longevity, including the elevated potential for stroke, heart attack, major depression, and disability, and I have seen these bad outcomes firsthand. We have devised a system where we can come to you through an easy-to-schedule process and with an approach that tries to anticipate and manage all your concerns. I practiced medicine in the intensive care unit for many years, and I know that the modern medical system is failing to give people the preventative care it deserves. I experienced so much heartache meeting people with advanced conditions, uncontrolled high blood pressure and diabetes, morbid obesity and heart failure as a few examples, and feeling helpless to do anything about it. By the time people come to the ICU, it's often already too late. And again, while monitoring these patients, we routinely discover they have things like low oxygen while sleeping. After spending so much time in ICUs, I wanted to be a part of something where I can be proactive in helping to stop people's medical decline. SleepDoc LA means a lot to me because I have come to learn that saving a life doesn't have to be a dramatic event in a hospital. It can be through a long-term relationship built through trust, helping to guide people on the right path. Please schedule an appointment for you or your loved one at sleepdocla.com today.